So FMC is our Family Maternity Care Service. It's both of our OB and our pediatric care teams. It's a great learning opportunity and gets you a really good full scope of family medicine approach where you can go around on a peds patient, see some newborns, do a circumcision, and then also be managing a labor all in one. So it's a good variety in a day. And it's been one of the most rewarding parts of my practice, just being able to care for moms and babies. It's the best if I'm delivering a baby from a family that I care for grandma, grandpa, on down, and they're all in the hospital all together, and it's just really rewarding.
So I think what's unique about our FMC service is that we have a broad primary care footprint here in Columbia, and we have enough family physician faculty trained in OB and inpatient pediatric care that our residents can learn those skills in patient obstetrics and pediatrics from family physicians, and that is not common. So we manage our own patients, and we provide that continuity of care and communication amongst providers, and our patients really value that. Also, the resident gets to learn one-on-one with an attending. So that is absolutely crucial for the resident learning all those skills and getting to get different attendings' perspectives day to day on how they care for that spectrum of patients.
So procedures that we do on FMC include things like intrauterine devices. We place IUPCs or intrauterine pressure catheters. We also repair any lacerations that occur during delivery process. We check all services throughout our labor management, and our attendings are there to help, but you are that patient's doctor. So any procedures that are available, you get first dibs on those procedures.
So I will say I have, this is the beginning of third year and I already have over 50 deliveries. That being said, that's something that I'm really interested in and hoping to be able to do after I graduate residency. I think that you can be as hands-on or as hands-off as you want to be. Though the attendings and the faculty really want to know that you're learning the skills necessary to manage deliveries well. So, they're also super understanding if you don't feel confident with a procedure, especially starting out as an intern. They will go right behind you and, double check cervixes and walk you through all of the procedures that that you need to do to manage a delivery. And then as second and third years, we get to do a little bit more independent management of labors and deliveries. So as second and third years, we run the night float service on our FMC service. So we're checking triages, checking services, managing labors pretty much on our own. Of course, if we have any questions or feel unsure about anything, the attendings are always there to answer questions, and they do a wonderful job of answering promptly and helping us out if we ever feel uncomfortable.
What I like most about working on the FMC, Family Medicine Maternity Care Service, is working hand in hand with the residents and students that we have. Usually we have a single resident paired with a single attending, which provides just a lot of good, meaningful interaction and conversation. Seeing patients in triage or on labor and delivery, you get that immediate feedback and a lot of real grounded education based off what you're seeing. We also have some core curricular activities and learning modules, and usually have some time to do some one-on-one teaching on whatever topic seems to be most relevant for that day.
I really love the continuity of care that you get when taking care of a pregnant person all the way through their pregnancy, and then I make a point to go to the deliveries for my personal patients, so getting to help them through that process and then seeing them afterwards for not only their postnatal care but also just their whole life care, and then getting to see their kid too. So that's really one of my absolute favorite parts of family medicine.